Assalamu alaikum. My name is Dr. Shaheen, and today I will tell you how to interpret CT scan in head and neck region. And first, we have to know about the normal anatomical structures of the head and neck region. And this is the axial view of the CT scan, and this is at the level of the orbits. And here we can interpret these are the ethmoidal sinuses. This is orbit. This is the inferior rectus muscle. This is the medial rectus muscle, and this is the lateral rectus muscle. And this is the middle cranial fossa, and this is posterior cranial fossa, and this is the petrous bone, and this is apex of the petrous, and this is the petro-occipital fissure, and these are the mastoid air cells. And these are the ethmoidal air cells, and this is orbit, and this is the inferior orbital fissure, and this is the pterygopalatine fossa, and this is the zygomatic bone, and these are the styloid processes, and this is the mastoid process. And medial to the mastoid process, this is the posterior belly of the digastric muscle, and this is vertebra, and the musculature, this is the medial pterygoid plate, and this is the lateral pterygoid plate. So there is a lateral pterygoid muscle, and this is the medial pterygoid muscle, and these are the musculatures of the palate, the levator tensor valley palatine muscle, and this is the levator valley palatine muscle, and these are the occipital condyles. And this is the region where the parotid gland can be demonstrated. This is the nasal septum, this is vomer bone, maxillary sinus, and this is nasopharynx, mandible, right and left mandible, right and left occipital condyles. This is styloid process. This is the axial view at the level of base of the skull, and here we can appreciate the different foramen. This is foramen ovale, and the smaller foramen near it is the foramen spinosum, and this is the foramen lacerum, and this is carotid canal, this is jugular foramen, and this is sigmoidal sinus. This is all at the base of the skull, and here in this level we can appreciate the mandibular condyles, both condyles, and this is the palatal hard palate is shown here in this view, and this is hard palate, maxillary sinuses, and this is mandible, and these are the muscles that are appreciated here, the masseter muscle, medial pterygoid muscle, and this is temporalis muscle, and this is vertebra. This is at the level of the maxilla, and this is buccinator muscle, and this is parotid duct, mandible, coronoid process, and temporalis muscle is attached at the coronoid process of the mandible, and this is lateral pterygoid plate, this is medial pterygoid plate. From here the lateral pterygoid muscle, and from here is passing medial pterygoid muscle, and this is external auditory canal, and here is the eustachian tube orifice, and this is mandibular condyle, and this is coronoid process, and this is the mandible. Floor of the mouth is visible in this view, and here is the submandibular gland. This is tongue, and the spinal cord, and this structure is sternocleidomastoid muscle, and this structure is trapezius muscle. And the floor of the mouth, it starts from the in the sagittal view. This is mandible, and this is white bone, and floor of the mouth lies here, and this structure is the base of the tongue. This is the tongue musculature, and this is floor of the mouth, and here the muscles of the floor of the mouth are appreciated. This muscle is mylohyoid muscle, and this is the hyoglossus muscle, and this is genioglossus muscle. And here the neurovascular bundle of sublingual space is visible. And this is the area which is called the retromolar trigone area, and most of the tumors are demonstrated here. And these structures are the submandibular glands. And the neck can be divided into 3 compartments, from the base of the skull to the hide bone, suprahyoid compartment, and from the hide bone to the clavicles. These are the clavicles. These are the infrahyoid compartments. And now how we can demonstrate the nodes, lymph nodes metastasis. And lymph nodes are differentiated from the blood vessels as they are less radiodense than vessels, and due to the shape that is oval in shape, and central necrosis, and anatomical location of the lymph nodes, which tells us the group of lymph nodes. So the level 1 lymph nodes, which are 1A submental lymph nodes, and 1B are the submandibular lymph nodes, and the diagnostic points are the anterior belly of the digastric. This is in the coronal view, 2 bellies of digastric muscles, and this is the level 1A lymph nodes, submental lymph nodes. And in the axial view, this area, the lymph nodes of level 1A are appreciated, and the landmark is the hide bone. At the level of hide bone, this is the submandibular gland, and anterior or adjacent to the submandibular gland, 1B lymph nodes are identified, and here these are the 1B, or this is submandibular gland. And level 1A is on axial CTs, this space looks like an A. So the level 1A lymph nodes are appreciated here, and this A is formed, and you can remember by this A at the axial view. And 1A lymph nodes are in the A space of the submental, are the submental lymph nodes, and 1B, it looks like a B in this region. They are appreciated here, which looks like a B. These are the submandibular lymph nodes, and from 2 to 4, these are the internal jugular lymph nodes, and level 5 are the lymph nodes in the posterior compartment, and level 6, it also anterior compartment, and the space looks like 6. And here the level 1A lymph node, this lymph node is level 1A, and it is in the between the 2 anterior belly of the digastric, and this is the submandibular gland. And level 2 lymph nodes can be identified if you have to remember the 3 landmarks, which is hide bone, posterior border of the submandibular gland, and anterior border of the posterior border of the sternocleidomastoid muscle. This is sternocleidomastoid muscle, and this is carotid sheath. This is submandibular gland, and the level 2A lymph nodes are between the submandibular gland and carotid sheath, and level 2B lymph nodes are anterior to the posterior border of the sternocleidomastoid muscle behind the carotid sheath, and the hide bone is identified at this level. Level 2A lymph nodes, carotid sheath, and level 2B lymph nodes and sternocleidomastoid muscle, and this is the trapezius muscle. And this in the coronal view, the hide bone is identified, and level 2 lymph nodes are identified, and level 3 lymph nodes, we have to identify the anatomical landmarks that this is hide bone, and this is thyroid cartilage, and adjacent to thyroid cartilage, this is the cricoid cartilage, and this is cricoid cartilage in the coronal view. And at this level lymph nodes are appreciated, and this beneath the hide bone and cricoid cartilage, level 3 lymph nodes are identified, and level 4 lymph nodes, we have to remember the anatomical landmarks that are the cricoid cartilage and the clavicle, and the this from this level to this, the near the internal jugular vein, the level 4 lymph nodes are identified. And from the cornal view of the skull, this is mandible, and from above this line, level 1A and 1B lymph nodes are identified, and these is the hide bone, and level 2 lymph nodes are identified from this level to this, and this is cricoid cartilage, this is internal jugular vein, and these lymph nodes are identified. These lymph nodes are in the level 3, and these lymph nodes are level 4 group. And level 5 lymph nodes, we have to identify the posterior border of the sternocleidomastoid muscle and the trapezius muscle, and inferior in the cornal view, the inferior border of the clavicle, and these are the level 5 lymph nodes. And this is the sternocleidomastoid muscle. The lymph nodes anterior to the region is level 2 lymph nodes or more anterior group. It may be level 3 or 4, and but this is at the mandibular level, so it is level 2 lymph 2B lymph nodes, and this lymph node is level 5 lymph node, which is behind the posterior border of the sternocleidomastoid muscle. And in the axial view, the 1B lymph nodes are identified anterior to the submandibular gland. This is the submandibular gland, and this is a 1B lymph node, and this is the carotid sheath, and anterior to the carotid sheath, level 2A lymph nodes and sternocleidomastoid muscle, and here the level 2B lymph nodes are identified. And in this view, this is submandibular gland, level 1B lymph node and carotid sheath, and here the 2A lymph nodes are identified, sternocleidomastoid muscle, and here 2B lymph node groups, and posterior to the border of the sternocleidomastoid, level 5 lymph nodes are identified. And this is the lymph node. And in this view, the 1A lymph node in this A region and 1B lymph node group in this region is identified, and this is the submandibular gland, and anterior to the submandibular gland, 1B lymph nodes are identified. This is 1B lymph node, and posterior to submandibular gland, 2A lymph nodes which are anterior to the carotid sheath. This is internal jugular vein, and 2A group is here, and this is the sternocleidomastoid, and 2B group is here, and posterior to sternocleidomastoid, level 5. Here is level 5. Here these are the level 2B lymph nodes, and this is also at the level of cricoid cartilage. So the here is 1B lymph node, and because this is at the level of cricoid cartilage, this group anterior to the carotid canal is the level 3, and posterior to the sternocleidomastoid is the 5. This is submental lymph node in the submental A region. This is 1B, which is anterior to the submandibular gland, and this is vagus nerve and carotid sheath, and anterior to this region is 2A, and 2B is at the medial side of the sternocleidomastoid muscle. This is also 2B lymph node, 2B, and posterior to the posterior border of the sternocleidomastoid, this is 5A. And level 6 landmarks are the anterior lymph nodal group, that is in the anterior compartment, starts from the hide bone to the manubrium sterni, and we have to identify the hide bone clavicles and the carotid sheath, and this is in the anterior compartment. In summary, you need to know the landmarks which can identify the different groups, which are the anterior belly of digastric, submandibular gland, hyoid bone, cricoid cartilage, sternocleidomastoid muscle, clavicle, carotids, and the sternum. And this is the arterial structure, and we have to differentiate the arteries from the lymph nodes, as the arteries are more radio opaque, and according to the size of the lumina, as the larger common carotid artery has greater size, when the as arteries go towards the head and neck region, they get smaller branches, and according to the anatomical location and bilateral existence and rounded shape. So we here at the level of the hyoid bone, we can identify the external carotid artery and internal carotid artery, and here is the facial artery. This is the external carotid artery, and the smaller branches, we should identify them according to their location, and we should remember where they are located and the bilateral location. Here both the ophthalmic arteries are located, and at this region superficial temporal artery with vein can be located, and at this region internal carotid artery is appreciated along with the internal jugular vein here, and at this level superficial temporal artery is appreciated, and here are the vertebral arteries, and this is the location of the occipital artery. And the branches of facial artery, the lingual artery is appreciated here, and this is the labial component of the facial artery, and this is mandible, and and these two structures are the this is retromandibular vein, and along with there is the sternocleidomastoid branch of the occipital artery, and these structures are the external carotid artery, internal carotid artery, and here is also ascending pharyngeal artery at this location, and vertebral arteries, occipital artery, internal carotid artery, external carotid artery, retromandibular vein, facial artery, submandibular part, and this is the deep cervical artery. And further branches, the labial part of the facial artery, mandibular part of the facial artery, submandibular part of the facial artery, lingual artery, lingual branches, mandible, and this is the vertebral arteries, occipital arteries, and external carotid artery. Internal carotid is lateral to it. This is external carotid, and this is internal carotid. And now we move towards the facial spaces that can be identified on the axial view more clearly, and this is the masticated space. This is mandible, this is lateral pterygoid, this is medial pterygoid plate, and from the medial pterygoid plate, medial pterygoid muscle arises, and from the lateral pterygoid muscle arises, and at the coronoid process, this is the temporalis muscle, and this is masseter muscle. This is the parotid gland, and it encases the parotid space, and this is the carotid space. It includes the carotid artery, and this is vertebra, and this is the parapharyngeal space, and this is the pharyngeal mucosal space. Here these structures are more clearly identified, and these are the fascia in the neck on the sagittal view, and this is the supraclavicular face, and this is the pretracheal face, and here is the this is the alar fascia, and this is the danger space that extends from the base of the skull up through the diaphragm. So it communicates infections up to the diaphragm, so it is called the danger space, and this is the prevertebral fascia, and this is the postvertebral fascia. And this is masticatory space, this is parotid space, and this is perivertebral space. This is parotid space, carotid space, masticatory space, retropharyngeal space, perivertebral space, posterior pharyngeal, posterior cervical space, parotid, and masticatory. And here the all structures are visible along with the spaces. This is the floor of the mouth, so this is the genioglossus muscle, this is the mylohyoid muscle, this is the hyoglossus muscle, and this is submandibular gland, and this is the buccopharyngeal fascia, this is vertebra, and digastric muscle is appreciated here at the level of the sternocleidomastoid muscle behind the parotid gland, and this is the internal jugular vein. This is internal carotid artery, and this around the carotid sheath, forward to this carotid sheath, this is level 2A lymph nodes, and posterior to carotid sheath, level 2B lymph nodes. And here is some cases you should know. This is at the level of the soft palate, and soft palate carcinomas can be identified here, and this is the base of the tongue, and base of the tongue carcinoma, and this is the oral tongue, and this is carcinoma here, and this is floor of the mouth, and the radiolucency here is appreciated. That is, and thank you very much.